So in chronic lymphocytic leukemia, there is one talk in the plenary session about the combined use of anti-CD20 antibodies and Chlorambucil in unfit patients with high comorbidities. So the typical CLL patient is an elderly patient with lots of comorbidity, and for these patients we designed a clinical trial years ago that compared three conditions: Chlorambucil plus anti-CD20 antibody Rituximab, or Chlorambucil plus Obinutuzumab, another anti-CD20 antibody. And so the last final follow-up of the trial is presented here and gave a relatively surprising result in showing that Obinutuzumab, so the one antibody, the new antibody, is inducing a survival benefit over the older antibody Rituximab. We didn't expect that. The study wasn't planned for that. But the meaning and the importance of this finding is as follows. First of all, even in the elderly comorbid patients with a lot of other problems, including heart problems, kidney problems, and so on, an optimized first-line therapy is very relevant in prolonged survival. Second, the new antibody is in CLL more potent and is improving survival, and therefore is one of the major elements of CLL therapy. So this is one important finding that will change practice also, because from now on, when you combine Chlorambucil with anti-CD20 antibody, we should no longer use Rituximab or Ofatumumab. Obinutuzumab is more potent. It is probably the new standard of care for this group of patients if you wish to give chemoimmunotherapy for unfit patients. So that's plenary session, Valentin Göde here at EHA in, I think, a few hours.